discuss thoracic outlet syndrome. Thoracic outlet syndrome is when you start having pain up in your shoulders. You can have numbness and tingling down your arm. You can have pain in your neck. It can cause headaches. And what happens is you have a lot of blood supply and nerves that come off your cervical, right off of that spine, and travel through that shoulder and down that arm. So right up in this shoulder here, we have a tremendous amount of blood supply and nerves. So lots of things can kind of contribute to this. So improper or really heavy overhead lifting can cause this. This could actually happen because of an anatomical problem. So how you were born, you have an extra cervical rib, which that rib in between this collarbone pinches down on that supply, that nerve supply, that blood supply, and causes that numbness and tingling. It could also happen from a traumatic injury. It could also happen from poor posture. Because if we sit in our chair with real rounded shoulders, we're typing, this is a lot of pressure on that blood and nerve supply. So we want to make sure that we have a good posture. Opening up that chest is really a big help. So 90% of patients are able to go to physical therapy, learn some exercises to stretch and to strengthen, and this helps correct this issue. At times, sometimes they do have to go in and they will remove part of that additional rib, or they would remove part of some musculature so that it makes more room for that blood supply and that nerve supply. So one thing that you can do at home is you can buy some NSAIDs. So over-the-counter anti-inflammatory medication. This is going to help reduce that inflammation in there. So it's also going to help control that pain so that you don't get that numbness and tingling in those cold fingers. Another thing that you can do is some stretching activities. So some good stretching activities. One stretch I like to use is either a big ball to sit on, or you can sit on a chair, and we're going to stretch that upper trap and scalene area here in the neck. So you can hold that arm down. One arm comes up over, and you're gonna keep that chin straight, and you're gonna pull that ear to the opposite side. Stretching, we wanna hold from 30 to 60 seconds, and we wanna do it 3 times on each side. So obviously we would wanna switch to the other side and perform this stretch. I also like to stretch the levator scapula. So it's very similar in that you pull that ear to the opposite shoulder, and then you take a look down towards your foot and give an extra little pull. And again, that stretching 30 to 60 seconds, 3 times on each side. So also, I like to use the big ball for some good stretching. And we can sit on the ball, walk out on the ball, and we can drop those elbows back. So we look up to the ceiling, chin up, and we can do a little curl up and try to lean back into that. Because what we're doing now is we're allowing gravity to help us open up that pec muscle, that chest muscle, where that we're being impinged here. Another great stretch is either a corner stretch or a doorway stretch. So the doorway stretch, we would place our arms, our elbows, and our hands up on either side of the door. and you're just gonna lean into it. And you really wanna lean into it. You can also change this stretch by taking it a little bit lower and leaning, or we can take those arms up even higher and lean into that stretch. Very, very beneficial for all of the poor posture that we have during the day. 30 to 60 seconds, and you want to do 3 of these. So to show a few strengthening exercises to counteract that thoracic outlet syndrome, we can take a band and we can hold either side of that band in the middle, and we're just going to pull apart and release. Pull apart and release. Making sure to keep those shoulders held down. We don't want the upper traps kicking in. That's what we're trying to avoid. So we pull apart and release. Pull apart and release. Strengthening, I like to do 30 repetitions and do that a couple times a day. So you could do that 2 to 3 times a day. Another great exercise to counteract thoracic outlet syndrome is if you have a big ball, you can lean down onto that big ball, and we can have those hands out in front of us. This is my favorite way because as we lift up, we keep the palms down, we lift, and we lower, and we lift, and we lower. To make it a little bit more difficult, we can come up into a plank position on those toes, lift, open up that chest, and lower. Getting into that lower trap muscle to help, again, hold that good posture. A couple other exercises that I like to do for thoracic outlet is external rotation. So not only is external rotation very, very good for thoracic outlet because we're working that shoulder, we're preventing this motion, we're coming up, but it's also good for that rotator cuff. So I'm going to use my little purple ball here as my pillow, and I'm going to take this weight, elbow tucked into my rib cage, and I'm just going to let it lay across the belly. And I want to lift that arm up and lower, and again up and lower. The main thing that you want to do with this is you don't want to shift the body back and forth. We want to make sure we stay stable. Weight is on the belly. Keep that elbow tucked into your rib cage. Lift and lower. This is a very small motion. So another really good strengthening exercise is a prone snow angel. So how we perform this exercise is we lay down on our belly and we place our forehead against the mat. Palms are facing downward, and we're just going to lift and bring the arms up and then return back to starting position. If this is too hard for you, you can also modify. If this would increase your symptoms too much, you could come out just to the side and down. So you place that forehead down and you reach up and over and bring the arms back down. And again, up and over and bring the arms back down. We want to make sure that we squeeze those shoulder blades together and we make sure to hold those shoulders down away from our ears. One more strengthening exercise is we can use this band and we can perform a row. So you can place that band in your doorway, or we can just use our feet, wrap around, and you roll those shoulders back, you retract and release. Retract and release. So these exercises are Very beneficial to stretch and to also strengthen. So you can also use heat to increase the circulation and allow those muscles to relax that are a little bit too tight. So you let them relax, and then in turn that also helps with circulation. So I hope this gives you some information and helps to benefit you. I'll see you again soon.